why does a baby with yellow skin worry a doctor? And why can one blood test save a life while another misses a silent killer? And how is it that a tiny drop of blood can tell us if your liver, your kidney, your heart, or even your brain are in trouble without us even touching them? Well, there's a science behind this life-saving phenomenon. And it's what we employ in the diagnosis that saves numerous lives. That hidden science is sort of like a bridge between chemistry and medicine. And that science is called chemical pathology. Chemical pathology. But before we unlock the fascinating world of chemical pathology, we need to understand the question, or rather, we need to answer the question of what is pathology? What is pathology? The word pathology comes from two Greek words, pathos and logos. Pathos refers to suffering or disease, and logos is study or science. Thus, the word pathology is simply the science or the study of suffering or disease. So pathology is the science, rather the study as well, of suffering or disease. Now, but today, it's more than just a poetic definition. And we define pathology as the medical specialty that explores what causes diseases and how diseases develop and what they do to the body, that's diseases, as well as we try to also see, most importantly, how to detect, predict, and treat them. So you think of pathology as the detective science of medicine, and it investigates the why and the how of every disease, from the common cold to cancer. Now, in understanding pathology, or rather a mnemonic that will help to remember pathology, are the P's, the three P's. And the first P talks about pathology being predictive, the predictive pathology. Then the next P is pathology being preventive. So pathology predicts, pathology prevents. So we have preventive. And lastly, pathology is personal. So personalizes. It's personal. Thus, these are the things that pathology is being applied to in modern day science. And do you know, by the way, pathology has contributed to more Nobel Prizes in medicine than any other field. And the reason for this is because it unlocks the secrets of diseases. So let's understand the historical perspective to how we came to where we are in chemical pathology. So historically, pathology as a discipline dates back over 2,000 years. And the ancient Greek physician, Hippocrates, who we often refer to as the father of medicine, believed that diseases came from natural causes. So diseases were not caused by angry gods. And what that entails was, in time past, people actually just felt like, oh, diseases were, well, let me say spiritual sort of. But Hippocrates was able to explain to his generation, and that explanation lasted numerous of years, uh, many years, that diseases had causes, and the causes were natural. But it was not until the 19th century that we had a massive explosion in the study of chemical pathology as we know it today. Because it was in the 19th century that things like the microscope and staining techniques and many other investigative modalities were gradually being invented, sort of discovered and employed. And finally, blood and body chemistry were revolutionized through the tests that were done there, and those tests led to understanding of disease. So, summarily, how pathology has evolved was that in the past we observed. In the past, people observed symptoms. People observed symptoms. Presently, we know and understand the cause. We know and understand disease causes. Disease causes. So this was in the past, and this was in the past, and this is how we understand pathology presently. Now. So that's how pathology evolved over time. There's a misconception though. Pathology is not just something that you see in autopsies or in crime shows like in CSI. In fact, around 70% of medical decisions, from surgery to drug prescriptions, are based on tests that are ordered and interpreted by pathologists. So every time a doctor looks at your blood and asks for a test, and then looks at your blood test, or the result itself rather, they are using the knowledge that pathology has uncovered. Now, suppose a 35-year-old woman in, say, Canada collapses. Oh, okay, let's say suppose a 35-year-old woman in the tropics, like in Africa, Nigeria, for instance, Lagos, collapses, and her doctor suspects malaria. But the lab test shows a different story, and it shows that she has severe anemia, and that severe anemia is linked to chronic kidney disease. How did the doctor know? It was through the use of pathology, especially blood chemistry tests that were ordered and interpreted via chemical pathology. So chemical pathology really plays a very essential role in health and how patients are managed today. So this is how it goes. You have symptoms. A patient comes to the clinic or you see a patient during rounds with symptoms. Then tests are asked for. Tell you to do a test, or they say the patient to do a test, and investigations requested. Then there's analysis done by the pathologist analysis, which will then lead to a diagnosis and would help in the treatment of that patient. So the next time someone says they are just running some blood tests, you should know that there's a whole world of expertise behind those little test tubes that they are using for those tests. Now that we know what pathology is and how it drives modern medicine, it's time we zoom in and explore the different branches of pathology, because not all pathologies do the same thing. And chemical pathology is just one mighty arm of a much bigger body. So in the next part, I'll take you through the types of pathology, and of course, trust me, this will help you understand where chemical pathology fits in and why it matters now more than ever. So coming up, look at the branches of pathology. So now that we've unlocked what pathology is, it's time to look at the big picture of the many parts that comprise pathology. So we'll be understanding the pathology, the branches of pathology. And this is where things get exciting, because pathology is it's like a huge tree, kind of, with many limbs, if you have it that way. And each of these is specializing in a unique way of understanding disease. And so to understand the branches of pathology, to understand the branches of pathology, let's take pathology to be an umbrella. So suppose this is pathology as an umbrella. Don't mind my drawing. I'm not very, I'm not very good in drawing, but I just assume. Came out quite good than I expected. But let's assume it's an umbrella, and the umbrella has, let's say, branches. So this is like this is the umbrella, and let's just say it has its branches. And take it that way. Anyway, so this is pathology as an umbrella with different branches, and let's put this like this, and put this like this, and put this. I don't know if you guys get it, but pathology. So let's assume that each of these branches are parts of, or constitute parts of pathology. So we have with this pathology, this, and there should be about 7 of them thereabouts. Actually 4, but you can divide them into roughly 7. Though in my own school I was taught about 4 during my medical school days. So pathology. Suppose this umbrella is pathology, and it has this branch. So what eventually constitutes this pathology? Now, to understand this, take each of these branches to be a part of pathology, and this then becomes histopathology. So we have histopathology, and histopathology is sometimes referred to as anatomical pathology. So let's take this as anatomical pathology. I actually prefer to use anatomical pathology because it sounds more holistic than histopathology. Because there's another part of pathology that is called the cytopathology. And sometimes people integrate cytopathology under histopathology. So that's why I was talking about, instead of writing the histopathology, I was writing cytopathology. But let's go with this. So we have another part of pathology as cytopathology. Of course, we have microbiology. By the way, there's a lecture on microbiology where I talk about the overview and scope of microbiology. So we have microbiology, and let's take this to be microbiology. Then we have what we're studying right now, which is the chemical pathology as a branch of pathology. So we have chemical pathology. Now, why do I keep writing my pathology this way? Now, there's the hematology, which is study of blood. It's another branch of pathology. Let's assume it's behind there. So we have hematology. This is the British spelling. However, the American spelling is without the H, without the A. So hematology. In America, it's written like this. Hematology. And there are 2 parts of pathology as well. Like I said earlier, in the histopathology, I could have just merged the 2, cytopathology and histopathology, to form pathology. So there's a part of pathology that is sometimes added with microbiology, which is known as immunology or immunopathology. So let's add that part as well. And we have another part on the branch, immunopathology. It understands how the immune system responds to diseases. And then lastly, there's a new branch of pathology that is relatively new compared to the others, but exists, and that is the molecular biology. So I think I should use, let's take, no, this is close to this, let me use a black pen. So maybe deep to the picture, we have molecular biology. Molecular biology and genetics. So, or let's just put it as pathology, since it's pathology we are referring to. So, molecular pathology and genetics. So, because the biology is essentially can also include physiology. Since it's a topic on pathology, let's focus on the pathology part of it. So, molecular pathology / genetics. So, these are the branches of pathology. Histopathology being chemical pathology, cytopathology, microbiology, chemical pathology, hematology, immunopathology, and the molecular pathology. And for the histopathology, what it does is it studies tissues with the use of microscopes. And this is a part of pathology that is employed in studying things like lumps and cancers and what have you. That's what it's said. Now, the histopathology, tissue, pathology. Cytopathology, on the other hand, is the study of how disease processes affect the cells. Cytopathology. Sometimes it is merged with histopathology to form the chemical pathology. So this studies disease processes at the level of the cell. Microbiology, if you look at my lecture, it was a lecture, I think I'll add that in the link below, where we talk about the history and scope of microbiology. Microbiology studies microorganisms, and these are tiny, basically any organism that cannot be seen with the naked eye, that requires the use of a microscope, studied under microbiology. And we have chemical pathology, which we're talking about today, which I will eventually try to talk more on subsequently in the lecture. Then hematology, blood. So hematology studies blood. It studies blood, kind of the physiology as well as the pathologies of blood. Things like the various types of anemias, causes of anemias, and even the cancers and malignancies of the blood. Immunopathology, like I mentioned while writing earlier, I said sometimes it's merged with microbiology because it's just the way of understanding how our immune system reacts to disease situations, so immunopathology. And lastly, there's a relatively new class in the branch of pathology, which is the molecular pathology and genetics. And that is where diseases are studied at the molecular level. So we've gone from the tissue level to the cellular level, down to the molecular level, and genes are used to understand pathology. So this is the branch of pathology. Now, personally, in my own days, when I was being taught pathology, I was taught pathology under chemical pathology, microbiology, which was sometimes, of course, medical microbiology, sometimes added with immunology or immunopathology. So I had anatomical pathology, microbiology, there was the chemical pathology, and there was the hematology. The molecular pathology was integrated, sort of, parts under these 4 branches I've mentioned during my own time and when I was being taught in school. So that's the branch of pathology. Now, having understood the branches of pathology, we'll go to the next part of our discussion. So, what exactly is chemical pathology? What is chemical pathology? What is chemical pathology? Chemical pathology is sometimes also called clinical chemistry or clinical biochemistry. So you can also put this as clinical. What is clinical biochemistry? It's another way some people call chemical pathology. So chemical pathology is the branch of pathology, like we've shown earlier, previous section of the discussion. The branch of pathology that studies the chemical and biochemical changes in the body caused by diseases. So the branch of pathology studies the chemical, the biochemical changes in the body caused by diseases. Now it focuses mainly on the analysis of body fluids, especially the blood and urine, and these are used to detect the abnormal chemicals, enzymes, and the hormones, as well as other substances that may be found in disease conditions. Now, suppose there's a blood, let's use a red marker, and we have the blood, and the patient has to, it's taken, maybe say the blood is taken through a test tube. It's a test tube. Let me use a red marker to indicate the blood. So we have the blood here, and that is taken to the lab. So we have the blood going to, let's say this is a lab machine. Just take this to be a lab machine. Whatever it is, just take it to be a lab machine. And they usually, let's assume they have some knobs here. And I don't know, this doesn't look like any lab machine I know, but let's assume this is a lab machine. So we have the blood taken through a test tube, sort of, to a lab machine. So chemical pathology is the study of disease through the chemical analysis of body fluid. And like I said, body fluids could be a lot of things: the blood, urine, cerebrospinal fluid, and what have you. So body fluids. And these tests help us to understand the changes that take place in the organs during disease conditions. And it's that understanding that helps us to reveal what the hidden problems are in the body in those situations. Now, the name clinical chemistry highlights that these tests are done in the clinical setting. So, having been done in the clinical setting, they are used to guide clinical decisions, including diagnosis and monitoring, treatment, as well as predicting outcomes. So, what are the examples of common chemical pathology tests? Some common chemical pathology tests that are employed today include things like when you hear they say do a blood glucose test. That's a chemical pathology test. And that's what is done to diagnose diabetes. We do check blood glucose test, for instance, for diabetes. We use what we call the serum electrolytes, like the sodium ions in the blood, as well as the potassium ion in the blood and all of that. And we also do liver enzymes. And liver enzymes could be the ALT and the AST. In subsequent lectures, we'll talk about that. Then we do the kidney function test in chemical pathology. And what that does is it tries to assess the level of some enzymes or some chemicals, substances in your blood, including things like urea and creatinine. I mentioned an example earlier of a woman that was suspected to have malaria, but following the test that was done, she had severe anemia due to chronic kidney disease. And so in patients with chronic kidney diseases, we have an elevated amount of urea in their blood. And so chemical pathology has different examples, like I've mentioned so far, of tests that are done, including the kidney function tests. In addition to that, we have the lipid profile. The lipid profile includes things like the triglycerides and cholesterol. You hear doctors say you have high levels of maybe cholesterol, or you mentioned the type of lipid, say high density lipid lipoproteins, and mention the low density lipoproteins, and just all those things they're mentioning as a result of lipid profile tests we've done through chemical pathology. And in addition to that, we have hormone tests, like for the thyroid hormones and other types of hormonal tests, including things like the cortisol. So these are examples of things done in chemical pathology. And by way of historical insight, chemical pathology began to take place as a distinct specialty, especially in the early 20th century, when scientists started measuring blood chemicals accurately. And the invention of things like the flame photometry and later automated analyzers revolutionized the field of chemical pathology. So in the 90s, the early 90s, we had quantitative blood tests that were done, and then subsequently we had things like automated analyzers that were integrated just around the middle of the 20th century. And towards the late 20th century, that's to the early 2000s, we had the birth, or rather the growth, of molecular and genetic analysis. So there was a molecular and genetic integration into chemical pathology. So around the world, the chemical pathology labs are actually on the front line, and they serve as warriors that help to fight against non-communicable diseases like diabetes and hypertension. And these are causing a lot of challenges in places like, for instance, Africa, Asia. There's a rapid rise in the incidence of, as well as in the prevalence of non-communicable diseases. Now, in low resource settings, like point of care tests, chemical pathology is being employed, and they are becoming essential they are essential to bringing chemical pathology closer to patients, point of care tests. So what are some of the practical applications of chemical pathology? Some of the practical applications of chemical pathology is, like I mentioned it previously, but I'll just paraphrase through them. Close to diagnose disease, because we try to diagnose this early. And then we also use chemical pathology to monitor disease progression and the response to treatment. Then we screen healthy patients to catch the risk factors early, and we try to guide the dosing of medications like warfarin and heparin and insulin. So these are some of the practical ways chemical pathology is employed in the health system. Always remember that lab tests must be interpreted carefully or in the context of clinical history, clinical symptoms. So for example, a patient that has elevated liver enzymes may mean disease of the liver or liver disease. But sometimes the elevated liver enzymes can also be as a result of medications being taken by that individual. So medicine could also be as a result of infections and even as a result of muscle injury. So always remember that lab tests must be interpreted carefully in the context of clinical symptoms and clinical history. So, by the way, there's a common misconception where they say, it's not just about, they talk about how chemical pathology is about blood sugar, but it's not just about blood sugar and cholesterol tests. It's a vast field that is incorporating hundreds of analytes and quality control, as well as test validity and even complex interpretations. And being advanced with what's the future, by the way, of chemical pathology? So with advances in things like artificial intelligence and in machine learning, in chemical pathology, the labs are becoming more accurate, they are more faster, and they are able to analyze. And measure massive data sets, sort of. And the integration of all this with genetics and molecular diagnosis is shaping personalized medicine. And this is where, remember earlier I mentioned the 3 Ps in chemical pathology, where we say it has predictive functions. And we also talk about how it helps It's personalized. If you remember the 3 P's I wrote. So, of course, predictive. What was the other thing? What the predictive, personalized, yeah, and preventive, yeah, preventive function. And it's so there's the integration of artificial intelligence and personalized medicine into this, and this is where treatment is tailored to the patient's unique chemical and genetic profile. So, but now that we understand the clear idea of what chemical pathology is and why it is vital, let's try and explore the fascinating history of chemical pathology. Let's see how it evolved over time. I think we should delve, I mentioned it briefly, but I think we should delve deeply into how it evolved over time to become the powerhouse it is today. So the next part we're looking at is the history of chemical pathology. So for the brief history of chemical pathology, we have from the ancient times. Let's just take this as an ancient pot. It's my pot. It's very funny, but yeah, ancient pot. So from the from ancient time to around the 18th centuries, the 18th century, the earliest chemical pathology was basically just observation of body fluids, and it's very similar to how microbiology also evolved. So people just observed body fluids like sweat and urine and saliva. And for instance, like the ancient Greeks and the ancient Egyptians, for instance, they studied urine color and the taste served as clue. In fact, the father of medicine, Hippocrates, noted changes in urine in diseases like diabetes, where he called it the siphon of honey. So that was what happened before the 19th century. Now, the 19th century was where there was a birth of modern biochemistry as we know it today. And of course, in the 19th century, I'm not good in drawing. Let's see this. This doesn't look like it. The base. Let's see, this is the base. Just a sketch. And the stem, this is supposed to be slimmer than this. The stem. Let me try to improve my drawing. So the stem, and then we have like the stage, where the slide is placed on. And okay, let's put it this way. I'm just trying to, you will know what I'm trying to draw when I'm drawing it. So this is this, and this. So we have this. So let's take this to be the microscope. So with the invention of the microscope, it looks quite, I did quite okay. Yeah, wow, I'm impressed. So yeah, the microscope, and in the 19th century, it was the birth of medicine because it was a breakthrough, and things like microscope were invented, and that led to massive scientific breakthroughs that revolutionized the understanding of body chemistry, in fact, even microorganisms. And likewise, around that period, early scientists like Justus von Liebig and de Claude Bernard, they studied the metabolism and the chemical processes in animals and humans. And with the invention of the microscope to a more advanced level, and of course the invention and discovery of laboratory techniques and methods for measuring blood chemicals, there was a boom and a rise in chemical pathology. But chemical pathology, as we know it today, emerged in the early 20th century. And that was where it emerged. And by the early 19th, labs started quantifying chemicals like glucose and urea in blood. So the invention of the flame photometry in the 1930s, for instance, was used and helped in measurement of electrolytes like the sodium and potassium. And eventually, in the mid 20th century, we had automations and growth, and machines were used. Automated analyzing machines were used. So in the 1950s and 60s, brought about automated analyzers that revolutionized chemical pathology. So machines that could perform hundreds of tests quickly were being employed. They made chemical pathology very fast, accurate, and was quite quick. And this led to widespread screening that were done around that period. So it made it possible. And this is the period that saw the birth of what we know as clinical enzymology, which is where we measure enzymes as markers of tissue damage. Now, in the late 20th to the 21st, late 20th century to the 21st century that we are in, is the molecular era, and we had things like the DNA, which is double-stranded, and genetics were being employed, and they became a part of chemical pathology. And you see, computers and informatics enabled better data management and interpretation. And these advances led to like in mass spectrometry and in immunoassays, where they help to improve sensitivity and specificity of tests that were done there. So in summary, the history of chemical pathology is such that in ancient times, fluids were observed. So we had fluids like urine being observed, and that now led to what we saw in the 19th century, where there was metabolism studies. In the early 1950s, 90s, we had qualitative tests, and like I mentioned earlier, in the 1950s, we had automated analyzers, and that led to the 2000s, where there was the integration of molecular studies and genetics. So this is how chemical pathology evolved to what it is today. Chemical pathology overlaps with many Nobel Prize winning discoveries in biochemistry and medicine. For example, the discovery of enzymes and hormones that are critical to lab testing. In Africa and many developing regions, chemical pathology labs are still evolving. But innovations like the point-of-care testing and mobile labs are bringing labs closer to individuals. And quality control, and as well as standard ways of lab assessment and measures are increasing, and that is being done alongside specialties growth today. So chemical pathology labs, are following chemical pathology labs where things like the international standards and the ISO, for instance, are being integrated, and that is helping to ensure accuracy and reliability of chemical pathology tests that are being done. By the way, fun fact, there's a movie called Outbreak, which was done in the mid-1990s. It highlighted how labs analyzed body fluids to diagnose deadly diseases, as well as showed the critical role of pathology in epidemics. So now that we've looked at how chemical pathology came to be what it is today, from ancient urine observations to the cutting-edge molecular tests that are done today, let's dive into the kind of like the bioscope of or within chemical pathology. So we're talking about the subspecialties kind of within chemical pathology. Let's look at the subspecialties in chemical pathology. Subspecialties in chemical pathology. And just like any other medical discipline, chemical pathology has its own subspecialties. These subspecialties help to focus on specific areas of biochemistry and the human function. If chemical pathology is a screen, these subspecialties are like, okay, if chemical pathology is like the ocean, these subspecialties are like the waves, and they are specialized and focused and powerful. So looking at the subspecialties in chemical pathology, these subspecialties in chemical pathology allows experts to dive deeper into a specific diagnostic test or area as well as disease, and each one answers different clinical questions and serves different specialties in medicine, ranging from endocrinology to nephrology and cardiology as well as pediatrics. So if this is chemical pathology, ChemPath, chemical pathology has subspecialties. And what are these subspecialties? Key subspecialties in chemical pathology include things like clinical endocrinology. And let's write this. Clinical endocrinology basically includes the study of enzymes and the endocrine system, endocrinology. And what we do in this place is we look at things like the thyroid and their diseases, try to also understand functions of thyroid, for instance, as well as hormones. Clinical enzymology is where we look at enzymes. Clinical endocrinology is the endocrine system. And so we focus on hormone testing, like in addition to what I mentioned, the thyroid, things like the adrenal hormones, for instance, cortisol, as well as reproductive hormones like estrogen and testosterone and what have you, growth hormones as well. And this is relevant to endocrinologists, to gynecologists, pediatricians, of course, in cases like hypothyroidism and what have you, general physicians, and it's used in conditions like thyroid disorders, or infertility, diabetes, Cushing's syndrome, Cushing's disease, Addison's disease. So this clinical endocrinology is a subspecialty in chemical pathology. And in addition to that, metabolic medicine, we deal with things like the inborn error of metabolism and metabolic medicine. Metabolic syndromes is another subspecialty in chemical pathology. So we have the metabolic medicine. And of course, even the mitochondrial disorders too, I under the metabolic medicine. And it's important in pediatrics, genetics, in neurology. I'm a huge fan of neurology. I love neurology. I'm going to keep talking about neurology a lot. So subspecialties like this help to screen the newborns for treatable disorders. Another subspecialty in chemical pathology is the toxicology and drug monitoring. And here we measure drug levels and look at how poisons, for instance, and toxins in the blood affect the body. And we ensure that medications are within the safe and effective range. And so that's the toxicology, of course, the word toxicology, study of toxins, toxicology, and drug monitoring. This is that's a branch, toxicology and drug monitoring, a branch of chemical pathology, and it's crucial for therapeutic drug monitoring, like in things like there are some drugs that have to be monitored when they are being given. Drugs like phenytoin and insulin and warfarin. These are drugs that are best monitored. Even aminoglycosides are used, are also monitored this way. And they are used in cases where overdose or poisoning emergencies occur. For instance, a patient that takes excess of paracetamol, so in paracetamol toxicity, for instance, toxicology and drug monitoring is done. And in addition to this, another part or subspecialty of chemical pathology is the clinical nutrition and trace elements. And there we test for things like micronutrient levels. We look at vitamin deficiencies and malnutrition, as well as electrolyte deficiencies. So, and this is useful in managing malabsorption, in managing bariatric surgery, chronic illness, and eating disorders. And that's the clinical nutrition. We have the clinical nutrition. So, and trace elements. Trace elements. Another subspecialty in chemical pathology is lipidology. Lipidology, because as the name implies, the study of lipids. Lipidology. And in lipidology, we focus on lipid metabolism as well as things that occur, or rather how they play roles in diseases, like lipids like cholesterol, for instance, triglycerides, high density lipoprotein, low density lipoprotein. These are vital in preventing and managing diseases like heart disease, for instance, even stroke, and atherosclerosis. So genetic conditions like familial hypercholesterolemia are diagnosed here. So that's lipidology as a subspecialty in chemical pathology. Another subspecialty is the renal chemistry, and there we test things like the kidney function, fluid balance, acid-base balance. There was a lecture, you can check it, where we talked about water and pH, and there we try to explain the acid-base balance in the body. And of course, fluid balance, how water itself is regulated in the body. So renal chemistry, so another subspecialty in biochemistry, in chemical pathology, where we study, all these things. Of course, it intersects with things like nephrology and intensive care medicine, as well as emergency medicine. Then we look at, by the way, we have the renal chemistry. Renal chemistry as a subspecialty, and chemical pathology. In addition to this, of course, we have it's kind of like two more subspecialties. We should break it down that way. We look at cardiac biomarkers, for instance, and this is where we focus on markers like troponin and CK-MB, as the creatinine kinase MB, as well as the brain natriuretic peptide, which is used to detect heart attacks and heart failure. And it's vital in emergency departments and ICUs. Then we have the point of care testing, and the specialty that ensures reliable, accurate tests done in bedside or clinic rather than in a centralized lab. So here's a practical example. Suppose a patient comes with chest pain and vomiting. These subspecialties are employed. Patient that comes with chest pain and vomiting, for instance, the chemical pathologists will be involved in doing things like checking for blood sugar, which is endocrinology. Or you'll be involved in checking for electrolytes and kidney function. which is renal chemistry. Or you have to check for things like the cardiac enzymes, for instance, which is like cardiac biomarkers. And you may even need to check for things like drugs, of course, if the levels are suspected, if drugs are suspected to be involved, or toxicity are suspected to be involved, and that's toxicology. So many countries are actually now developing national training in these subspecialties, and they're doing so as precision and diagnostics are becoming essential. And by the way, subspecialty labs are also open. They are opening up, as entrepreneurial opportunities in diagnostics and home testing kits are rising. And so now that we've looked at the subspecialties in chemical pathology, by the way, you can see that it's not a single road, it's a network of highways, and each of them are serving different organs and systems and specialties. But here's the question. What exactly is the role of this in real life healthcare? How does chemical pathologists directly improve patient outcome? And how they save life and guide treatment? And so that's what we'll uncover in the next section of this lecture. We'll look at the practical role of clinical biochemistry or chemical pathology in healthcare. Chemical pathology is employed practically in diagnostic support, which is the silent cornerstone of modern medicine. And you see, chemical pathology plays a central role in diagnosing diseases, sometimes even before symptoms show up. So, like for instance, if you think of diabetes, or you see, blood glucose is our first alarm. Like what we do, we use the blood glucose to know about diabetes. For instance, when a doctor is suspecting the patient has liver disease, what do? We check for the ALT, we check for the AST, and the bilirubin. Or a patient that comes with chest pain, we just mentioned that in the practical example I gave earlier, troponin rose in and out a heart attack. So doctors rely on all these tests as social biochemical evidence to confirm what the body is silently screaming. No diagnosis is complete without lab support. And chemical pathology is the backbone of that support. Now, in addition to the diagnostic support, the silent cornerstone of modern medicine, the second part where chemical pathology is employed is in monitoring disease progression and treatment. So after diagnosis, the next thing that comes is treatment. But how do we know if it's working? Chemical pathology answers that question. So we check, we ask, is the chemotherapy helping? We check for the tumor markers to see if the chemotherapy is helping. Or not just the chemotherapy, we also look at insulin. So we say, is insulin effective? We track what we call the glycated hemoglobin over time. We also ask the patient, the kidney of the patient improving, for instance. We try to measure the urea and creatinine. So these numbers, they speak when the patient's body cannot. And they help the clinicians to adjust doses and switch medications, or even consider treatment plans. Of course, in addition to this, we have the preventive medicine, which is helping to spot trouble before it even starts. So we use chemical pathology, and this is employed in people that are not even sick. So what we now do is it's about keeping, we try to keep people that are healthy. And we do cholesterol tests to predict heart disease risks. We do thyroid screening to detect problems in pregnancy. We do things like vitamin D and iron and B12 levels to help prevent deficiencies of this. So chemical pathology is employed in addition to the first two in preventive medicine as well. And in addition to this, we also use chemical pathology in hospital and emergency medicine. Of course, I refer to it as the unsung hero. And in emergency rooms, for instance, test results are used because what give the difference between life and death. We hear of hyperkalemia, for instance, hypertension, which can result from kidney failure. Hyperkalemia, by the way, is something that can actually kill a patient. Of course, if untreated, it just stops the heart. So chemical pathology detects it fast. Or a patient that has infection, sepsis, for instance, we can check for prolactin and what we call CRP, and that guides the urgency and treatment of that patient, or even a patient that comes with diabetes and is in coma, so diabetic coma, for instance. The glucose and ketone give us the answer. So you see, chemical pathology actually brings that speed you need in hospital emergency cases and emergency medicine, the speed and accuracy that is required. Now, not just in hospital settings, even in public health and in epidemiology. I mean, if you want, have you wondered how public health officials track, they track trends and they track environmental toxins and metabolic disorders in populations? Chemical pathology is central. So, mass screening for neonatal hypothyroidism, tracing lead exposure in water, and managing outbreaks of hepatitis and what have you. All of these are lab-based biochemical tracking by chemical pathologists. So that is also, chemical pathology is being employed in public health and epidemiology. Now, in addition to those points, another place where chemical pathology is practical is in drug monitoring and toxicology. I keep on emphasizing this because in case of poisoning or overdose or drug therapy, chemical pathology becomes the detective. So the therapeutic drug monitoring, for instance, ensures drugs like phenytoin, lithium, digoxin, warfarin, insulin stay within the safe, effective range, because too high, issue, too low, ineffective. So toxicology panels as well, in addition to the therapeutic drug monitoring, are employed, and there we detect for things like alcohol or patient that takes, say, drugs like opioids, for instance, or heavy metals or industrial toxins. Practically, that's how chemical pathology is employed, and this is essential for maybe psychiatrists or for the surgeons or for the anesthetists or for emergency physicians alike. The integration with AI and personalized medicine too is there, and so we're entering a world where your genetic profile and chemical fingerprint will personalize your treatment. So chemical pathology is at the center of this revolution. And biomarkers guided cancer therapy, for instance, or predicting drug reactions through what we call metabolomics. Yeah, metabolomics, that's what it's called, yeah. So doing those things require the knowledge of chemical pathology. And AI-assisted lab interpretation, for instance, for population scale screening. It's not science fiction, by the way, it's the future of healthcare, and it's happening now. So all these are being employed by the knowledge derived from chemical pathology. And this guides and informs, prevents, and saves. And of course, it may not have. You see, chemical pathology may not have let's say the drama kind of the scalpel or the glow of the X-ray. Don't have that drama that the scalpel has in the operating room, and may not be as catchy sort of as the X-ray, but it quietly powers almost every clinical decision that doctors make today. So if this is, let's say this is hospital environment, chemical pathology, this branch, I don't know why I like to draw trees, but suppose this is the root is chemical pathology. Chemical pathology. And the branches of this tree can draw the tree. The branches of the tree, of course, diagnosis and screening and monitoring. Just mention them. Chemical pathology plays a role in them. So in the hospital, chemical pathology is non-negotiable because you need it for a lot of things. Prevention, emergency care, mean them. Chemical pathology. So now that we've seen what it does, let's pull back the curtain on how it's done and try to understand the methods and the measurements in chemical pathology. So we'll try to understand the methods and measurement of how chemical pathology is employed in the hospital setting. Imagine a detective who doesn't guess, but measures. And instead of asking suspects, he runs tests. And he runs those tests on fingerprints or on DNA or chemicals at the crime scene. That detective, that's the role of chemical pathology in your body. That's the role of chemical pathology in your body. So, how do we do this? What are the methods and the measurements we use in chemical pathology? We do things called the analytical techniques. And these analytical techniques are used in chemical pathology. And what that entails is the utilization of both classical and modern laboratory techniques to analyze bodily fluids. Of course, this includes spectrophotometry, which measures how much of a substance absorbs light, used for enzymes and used for things like glucose, bilirubin, and amino acids, bilirubin and enzymes. Then we have the electrophoresis, which separates molecules based on the size or the charge, kind of, including molecules like proteins and molecules like hemoglobin. The electrophoresis separates them. Then you must have heard of chromatography, which may either be the gas chromatography or the lipid chromatography. And that's used in drug testing and detecting toxins. Of course, there's the mass spectrophotometry, which is highly sensitive and utilizes helps to identify compounds, unknown compounds. Of course, the amino acids too are there, and that rely on the antigen-antibody reactions in the body to try to detect hormones and drugs, as well as tumor markers. Even ion-selective electrolytes are also being employed, and they are used in the analysis of electrolytes like sodium ions and potassium ions, and so many other analytes in the body. Of course, I'm mentioning point-of-care testing, and that is another way we have analytical techniques. That's another analytical technique that is used in chemical pathology. And it's sort of like a bedside or portable device that's being employed for glucose or troponin. So, in addition to this, it's good to understand the types of specimens used in chemical pathology, because chemical pathologists work with specimens. And some of these specimens include the blood, like I mentioned earlier. The blood may either be the serum or the plasma. And the most commonly analyzed sample in chemical pathology. Then body fluids like the urine, which is used for checking for glucose, for protein and drug screening, as well as the cerebrospinal fluid, the CSF, which is especially used in central nervous system infections or malignancies. Even saliva and sweat, the amniotic fluid in pregnant women, the synovial fluid in joints, they are used for specific tests. And each of these specimens have their pre-analytic modalities that are being employed in them to get the best outcome. So what is measured in this chemical pathology? Chemical pathology investigates what's normal, tries to understand what's too much and what's missing. So we look at electrolytes like the sodium ions or the potassium ions or the bicarbonate ions or the chloride ions. We try to see if they're normal or they are too much or they are missing. We also look at things like the renal function test, the urea, the creatinine, and try to do what we call the estimated glomerular filtration rate. Liver function index too, where things like the ALT, the AST, and the ALP, and the bilirubin are analyzed. Of course, the blood glucose is also there, or the glycated hemoglobin is there. And in addition to this, we have the lipid profile, cholesterol, high-density lipoprotein, low-density lipoprotein, triglycerides, even the hormones. Don't forget the hormones. The hormones, the thyroid-stimulating hormones, the insulin, the cortisol, and tumor markers, for instance, as well as cardiac markers, even enzymes and proteins. So these measurements are quantitative and they require precise calibration or control as well as interpretation. And of course, you need quality control in measurement. You need quality control in measurement. So chemical pathology labs adhere to strict quality control systems. Internal quality control is there. External quality control assessment is there. Calibrations are there. Even standard operations of procedures are there, or standard operating procedures are there. So now for the internal quality control, by the way, it monitors tests and the consistency of those tests within the lab. The external quality assessment is where you compare a lab's performance to other labs, whereas the calibration is where you align the equipment, the readings with known standards. Of course, the standard operating procedures just basically what is followed meticulously to get the best outcome. So without these proper quality checks, even the most sophisticated instruments become dangerous because it just gives results that are just like guesswork. So it's also important to know about the interpretation of results. See, results are not just numbers. They must be interpreted in context. Context to the reference range, which of course depends on the population, the age, or the sex, or the method being used. They are also, excuse me. You need to also measure them in the context or interpret them in the context of physiological variation, like diurnal reading, maybe how the person sleeps and wake up, kind of, and pregnancy or fasting, or pathological variations, for instance, because in disease states like diabetes and liver failure, there are different results that may be gotten. So you need to also look at all this and try to, in fact, there are some places where you have to look at interfering factors, factors that interfere, like hemolysis or drugs, or even improper sampling handling, for instance. These are factors that you need to consider. So so in interpretation of results, you have to make sure that you don't just take the numbers, try to interpret them in context. And that's why chemical pathologists try as much as possible to connect the dots, not just import numbers, and they give clinical meaning to data. Likewise, you need to take note of the emergency methods, because we have lab automation, robotics for throughput. AI is being integrated now for pattern recognition in diagnosis. And in the lecture we had on water and pH, we talked about wearable biosensors, which are used for real-time biochemical monitoring. So these advances are making chemical pathology faster, and they're making chemical pathology smarter and more personalized. And so you need all of this. Now, to understand holistically what these methods and measurements in chemical pathology are, you need to know that a part of it has to do with the specimen, which is blood and urine and cerebrospinal fluid. Another part has to do with the electroanalytes, the glucose, the creatinine, the troponin. Then there's the quality control as well as the interpretation that is being employed there. Let's bring everything home now. Let's bring everything home and unify all we've been saying about chemical pathology by way of an overview of it. So chemical pathology is not just about test tubes, okay, or analyzers and numbers. It's about people, it's about life, it's about decision-making in medicine. And it serves as the bridge between biochemistry and bedside decision-making, as well as bedside care. It helps to turn those molecular patterns you see into visible, valuable clinical actions. So we began this lecture, by the way, if you remember, by exploring what chemical pathology is. We defined it as a branch of pathology, which is concerned with the biochemical basis of disease. We talked about it through its detection, through laboratory tests in body fluids, especially what? The blood and the urine. So from there, we took a journey through history from ancient urine testing of physicians to the invention of analyzers, automated analyzers, down to the integration of AI and molecular studies. And having looked at all that, we talked about the subspecialties in chemical pathology. We mentioned them, and their roles in chemical pathology. Of course, in addition to that, we eventually mentioned the methods and the measurements that are being employed in chemical pathology. Now, I want to bring your knowledge back, or back to, I want to bring your back to your notice what we started with at the first point of this video. We talked about pathology itself, and we talked about the branches. And so I would like you to go and explore the other parts of pathology, which if you check the channel, you would see there are other lectures covering other parts of pathology. And so these are the things we looked at in this lecture on the overview of chemical pathology. So always remember that the lab is not just a room with machines. It's the pulse of modern medicine. So the next time someone asks you, what's so special about chemical pathology? You can smile and say, it's a science, that sees disease before the doctor can. Thank you for joining me on this lecture. Stay curious, by the way, and stay compassionate, and always respect the numbers because they don't lie. More importantly, learn to interpret them wisely because behind every lab test is a life. Now, I'll be talking in the next lecture on chemical pathology, on how samples are collected. And we'll look at the sample collection, look at the processing of samples, and the storage of sample, and the transport and the storage of sample. So I'll see you in the next chemical pathology lecture. Take care.